everyone, this is Shabnam here. Welcome back to my channel, The Counseling Corner. So in today's video, I am going to speak about a severe mental illness which is known as the bipolar disorder, which is very common among the people. So what exactly is bipolar disorder? See, bipolar disorder is a serious mental illness and it will be characterized by severe or extreme mood swings. Suddenly a person might experience high, that is, he'll be very excited and happy for no reason, and the very next moment he might experience feel very low or feel depressed. And these episodes of mania and depression may last for several weeks to several months. What you have to understand is that bipolar disorder does not have a permanent cure. It is a lifetime disease, but treatment can be given only to control or suppress the symptoms. If not identified and treated at the early stage, the symptoms would become worse as the age grows, and it would lead to suicide. The suicidal rate among the people with bipolar disorder is found to be really high. So let's quickly see what are the causes, what are the symptoms and the treatment of bipolar disorder. So the exact cause of this bipolar disorder is not known, but experts say that multiple factors contribute to bipolar disorder, and one among them is the chemical imbalance in the brain. And second, the most contributing factor, you can say 80% the contributing factor is the genetics. Apart from that, there would be other triggers due to stressors like divorce, loss of loved one, financial crisis, loss of job, physical, verbal or sexual abuse during childhood trauma. So these could also lead to bipolar disorder. Regarding the symptoms, if the person is experiencing mania, then he would be extremely happy and excited, and he would indulge in risk-taking behavior. He will be easily distracted. He will not be able to focus and concentrate on anything. And he will also indulge in activities like overspending beyond his capacity, for which he might have consequences later. As well as he would experience symptoms like hallucination and delusions if it is an extreme case. So during the depressive episode, the person will be extremely sad. He'll experience feelings like a feeling of hopelessness, feeling of worthlessness, feeling of helplessness, self-doubt. He would not be able to focus and concentrate on anything, complete loss of interest in the activities which he used to enjoy earlier. Right? There would be changes in his sleeping and eating pattern as well. Either he would be sleeping too much, or he would not be getting sleep at night, or he would be feeling hungry and eating throughout the day and putting on weight, or there would be a loss of appetite and he would be reducing a weight, and he would be totally isolated, withdrawn, and in extreme cases he might experience hallucinations, delusions, as well as he might have suicidal tendencies. Regarding the diagnosis, first a medical examination would be done by the doctor, and then a lab test would be suggested to see the thyroid. And if there is no medical concern, then the psychological assessment would be done by the psychiatrist. Regarding the treatment, as I've already mentioned, there is no permanent treatment for bipolar disorder, but yes, medication and treatment could be given to reduce the severity of the symptoms as well as to reduce the number of episodes of mania and depression. Other treatment apart from medication would include cognitive behavior therapy, family therapy to the family members as how to deal with these patients, as well as talk therapy, counseling, and lifestyle changes would be recommended. In case the person is having mild symptoms, then he could be treated as an outpatient. But if the person is having major symptoms like suicidal tendencies, then he has to be hospitalized and given treatment. Regarding the patterns of mania and depression, a person suffering from bipolar disorder would experience more of episodes of depression than of mania, and in between them he will have a normal period. Again, this is divided into two types. One is known as the rapid cycling. In this, a person would repeatedly experience mood swings from high phase to low phase quickly without a normal period in between. Second is known as the mixed state. Here the person will start experiencing the symptoms of both mania and depression at the same time. For example, you can take overactivity with depression. The rate of bipolar disorder among the people is increasing day by day, and it is becoming one of the contributing factors for the increase in the suicidal rate in our country. So please do share this information as much as possible, and if you had liked my video, please do subscribe to my channel, The Counseling Corner, and hit the bell icon so that you get timely notifications whenever I post my new video. Thank you so much. See you next time.